We're going to go ahead and get started in just a minute, allow people some time to join, but I want to make a quick technical announcement just to say that during the presentation, feel free to introduce yourself in the chat box, and you're welcome to ask questions also in the chat while the presenter is speaking, and then during our Q&A portion, you can feel free to unmute yourself and speak freely, and we'll have a discussion. So with that, I will pass it over to Dinah.
Okay. Thanks, Sitan. Good morning, good afternoon, or good evening, depending on your time zone. It's great that you made the time to join this webinar. We appreciate your participation, and we look forward to an interesting discussion this morning. I'm Dinah Kasungami. I work for JSI, and I am the lead coordinator for the Secretariat of the Global Child Health Task Force. And so to start off this morning for me, I wanted to just remind ourselves about the goal of the Global Child Health Task Force. And to do that, I wanted to use actually the title of the webinar, or the theme of the webinar this morning: Participatory Systems Mapping Implications for Improving Urban, Maternal, and Child Health Outcomes. And this is an example of a theme that speaks to the goal of the Child Health Task Force, which is to strengthen equitable, comprehensive child health programs. They are focused on children aged 0 to 19 years. And this is in line with the global strategy for women's, children's, and adolescents' health. And we hope to achieve this through partnering with ministries of health, donors, and NGO partners through comprehensive primary health care and inclusive of community health systems. We work under 5 themes. We advocate, we convene stakeholders in order to improve coordination amongst ourselves. We are a learning and sharing platform. We aim to support countries. That's an emerging area of work, and we do knowledge management. Speaking about the global strategy for health and building on the Millennium Development Goals, we know that now we address the child with the Survive, Thrive, and Transform mandate. And we know that to achieve that, we need a multi-sectoral approach. And this is what this webinar will demonstrate, how you could use this multi-sectoral approach, and also increasingly trying to focus on urban health and cities that are somewhat different from the issues that we address with children who are living in rural areas. And to lead the webinar, the presenter this morning is Amanda Pomeroy-Stevens. Amanda works for JSI and is the project director for the USAID Building Health Cities project. It's a 5-year project. Amanda is an economist by training, and she has 15 years of experience in research and evaluation. She's worked at JSI and led projects on urban health, non-communicable disease prevention, and nutrition financing and governance. So she brings a broad range of skills and experience to this discussion. Amanda specializes in economic evaluation, complex survey analysis, and systems strengthening, and she has published work in these areas. So without taking too much time, I'll hand over to Amanda to share the presentation that she has with us.
Thank you, Dinah and Sita, and welcome to everyone. I'm excited to talk to you today. As Dinah mentioned, we're going to be sort of touching on some of the multi-sectoral aspects of this project, and also focusing in on one of the techniques we're using to help make that idea or that theory more functional at the project level. And I will be presenting this, the slides, but I wanted to also mention that my colleague, my deputy director, Damodar Bachani, who is integral to this project, is also on the line. And so when we get to the question and answer session, I might be asking him to jump in and give some more specific examples as well. So as Dennis mentioned, this is a 5-year project. We started in 2017. We are funded out of the USAID Asia Bureau. And we are partnering with now 4 smart cities. And a smart city, if you're not familiar with that term, is a city that is receiving money either from its own central government or from provincial government or from the private sector to upgrade their built environment and or their information and communication technology, or ICT. And we wanted to work with these cities, not just because they're smart cities, but because with the exception of Kathmandu, they're all secondary cities. And inclusive of Kathmandu, they are between 1 and 2 million population and have quite a high growth rate. So the idea is that we're catching these cities before they become the next mega cities in Asia. They're all doing relatively well, economically speaking, but they're growing so quickly that they are leaving certain populations in the dust, or they're attracting populations so quickly that they're having trouble expanding. And so working with the smart city mechanism allows us to talk to multiple different facets of those thinking about city growth, so that as they're planning for the future city in 10 or 20 years, they're thinking about a healthy, livable city. That's really what we're supposed to be doing with them. And we are testing. This is a learning project. So we're really testing, evaluating, and documenting what could work for this new model of urban health, or as we like to call it, healthy urban planning. Just as a real quick snapshot of our overall approach, as I mentioned, as we start to talk about healthy urban planning, we're drawing lessons from each of these cities, trying to learn what is really essential to the work in this area. And what we've come up with thus far as we enter year 4 of this project is 3 core values. You see them in purple in the middle of this graphic. So multi-sectoral engagement is really crucial, citizen empowerment, and data-driven learning. And while these are not new ideas, some of the ways that we're trying to apply them might be. And we do expect that every single thing we do, and we're trying to encourage everything that the city is doing in this area, includes all 3. It's not a matter of doing something in each of them, but every single one of these has to shoot through every activity. So this sort of grounds our approach as we work across about 7 or 8 different sectors in each city. We've listed some examples to the left here. Health is certainly an important sector we work with, but urban planning is actually the main hub. Either urban planning or information and communications has tended to be the main municipal hub that we work from, where they host the Secretariat of Multi-Sector Planning in this area, where they're receiving their smart city funds, and where they have the broadest touch points across many sectors. As you may know, with health, sometimes if leadership is housed under health, other sectors feel either alienated or like they're not really bringing a lot to the table. And so this is part of the reason we do this. But we also work with women and children, nutrition and food safety, education is a big one for us, water and sanitation, waste management, environment and natural resources, transport, and in one case, tourism and commerce. And these all do link back to health outcomes. We'll give you a few examples of this, but just two that I can name from this list that maybe are not intuitive is that we're doing health promoting schools work with the education department in Indore, and some similar health education in schools in Vietnam. I can speak to how these link to child health for this particular audience, but we're also doing a set of videos because a lot of our money comes from maternal and child health, and people do ask us sometimes, how do some of these more indirect activities link back to these outcomes? And so we've done a literature review, and we're going to be creating some animations for lay audiences to talk about how do these, what we call social determinants of health, link to child health and maternal health outcomes. And just for clarity, if you haven't heard of social determinants of health, which I'm sure many of you have, but just to explain sort of how we are seeing this and how this is playing out in many of our cities, these include things like direct clinical care, but also working on improving air and water quality, or helping with increasing food safety and hygiene in many different outlets, including school kitchens. Even things like formal tenancy, so making sure people actually have the right to live on the land that they're on or in the house that they're in, which avoids forced evictions, which can have quite an impact on mental health and health outcomes. Other aspects of school environments, and then higher level things like the multi-sector resource and data coordination, which is really critical at the city level and even the district level. And of course, thinking about health equity, thinking about equitable distribution of services. And when I say services throughout this presentation, we do mean health services, but also health-related services like garbage pickup and water distribution and electricity and things like that. So from the literature review, we're actually seeing really documented impacts of these types of social determinants of health on infant and under 5 mortality. And infant mortality, it tends to be through reducing the incidence of low birth weight, as well as preterm birth and stillbirth. With under 5 mortality, there's usually big reductions around stunting and wasting, incidence of diarrheal disease, which you can certainly imagine where the linkages are across that list that I mentioned, and incidence of ARI. So, as I mentioned, we work in 4 different cities in very different contexts. This is on purpose. The Global Health Bureau and Asia Bureau wanted to really understand how this might work in different situations. But I'm going to use the case of Indore, India, for the sake of this half-hour presentation to give you some sense of how this plays out and how it relates to child health activities. So Indore is in Madhya Pradesh. It's one of the largest cities in the state. And we've worked with them the longest. We've done these infographics for each city to try to explain, because we want to adjust this approach to each context. It is flexible in terms of the specific activities, though, of course, we have these core values. And we work with the city leadership to define what we call a guiding statement, or what are we all working toward? That's actually a really important thing when you start such a wide-ranging project, is to really make sure everyone's on the same page about what is the end goal. What does building a healthy Indore mean? And Indore, it's been named the healthiest city in India for 4 years straight. So it's got a lot going for it. But as I mentioned, there are aspects that are getting left behind. So we actually have quite a wide range of activities. Some are more intuitively linked to maternal and child health, things like maternal and child nutrition, NCD prevention, healthy communities, smart health centers. We're doing some work on under 5 nutrition, and then of course health promoting schools, as I mentioned. But then as you see, there's some other things that might seem a bit more indirect, like air quality monitoring and clean urban environments, safe pedestrian access. But these do link back to child health, and we'll talk about how we map this. One of the biggest challenges we've had in doing these systems level projects, and this is true in indoor and across all of our cities, is as we start to get into these different areas, we need to be able to index all of the research that we're doing, because we have multiple different research activities, as well as pilot projects. There's also partners working in the city. This is not a vacuum. These cities are very dynamic contexts. So how do we index all of our and others' research across all of these different areas and link them back to the city context, so that when we're talking to city leadership, the planners and the financiers who have to actually take this stuff forward when we're gone, how do we make very clear sense of all of this information? And instead of presenting them with one set of recommendations after another, as often happens with separate research documents. We also needed to create buy-in and real-time feedback mechanisms throughout this entire process. So starting from the very beginning, we are doing research, but I think of it as applied research. And so you can't wait for 1 or 2 years to present results to the city, because you might have different leadership by then. You might have very different people in each sector as your points of contact. So you have to start all over again. So really keeping everyone involved throughout the process, and really getting their input and their knowledge and expertise throughout that process was critical for us. And then finally, as a last sort of key challenge for us, is all of this work needs to produce practical and actionable guidance. That's what cities want. They may be interested in certain parts of what you're doing, but what they need at the end of the day is, what do we have to do? How much is it going to cost? And how will this improve my city? How am I going to sell this to my constituents? So from that, we talked to a lot of different groups, trying to understand how we could pull this together. And we ended up partnering with a group called Engaging Inquiry. And they're fantastic. They've come up with an iteration of what is called dynamic systems mapping. So this is not a new idea. Systems mapping has been around in the engineering world for quite a while, sort of quantitative systems mapping. It's been used in other contexts as well. And systems thinking is also not new, but I'm sure many of you have read at least one systems thinking document where by the end of it, you're more confused than at the beginning of it, and it doesn't give you any practical guidance for how to actually apply this to a program. So what we liked about Engaging Inquiry's approach is that it did feel very rigorous and yet practical. And so their maps can organize a huge amount of information, acknowledging interconnections between aspects. And this was critical for us, because that's what systems thinking is about. And in an urban context, you have a lot of interconnections. So you want to know, if I pull a string here in the system, what's going to happen elsewhere? What are the positive and negative outcomes of that throughout the system? It's also a very participatory process that pulls in every level of stakeholder from the beginning. So we create we facilitate the cities to create sustainable multi-sectoral platforms in either the urban planning or mayor's office or the information and communications department. And then from that platform of city officials, we also add in community town halls and community civil society organizations, and then others from academia and the private sector. And they stay throughout the process of systems mapping. Finally, it develops this transparent, really visual framework of where best buys might be, and how they could be implemented. And so this is what drew us to this approach. I'm not going to go into the real nitty-gritty details, but I wanted to give you just a little bit of an understanding of the process. So there's generally 3 phases to this. Theory of context is really getting people together to talk about, how does the system currently work? Or what is the context? And a lot of us try to do this through formative assessments, but then they never get read. And even for me, if I've helped to write a formative assessment, I struggle sometimes to go back and find what I'm looking for in there. So this theory of context is a really clear way of talking about what is currently. We pull this together from the feedback from our participants and from our own research. and then try to get this turned around quickly back to another workshop with our participants that we call the theory of change, where you're really identifying where there are opportunities in that system to make an outsized change. So where is that Best Buy opportunity? You're still not to the point of action. You're looking at what are sort of the prerequisites that you have to make that bigger change. And in between each of these phases, we are doing additional meetings to socialize and get feedback on the maps from every different angle. And then we conclude this series with the theory of action. So again, a workshop, this picture is from that. I have always joked about, people playing with pipettes and Legos in these workshops. But here, you're actually building on a map. You're trying to think about what can we actually change here. And so the idea is that you're identifying where we can best apply resources to take advantage of the opportunities that you identified in the previous step to improve the system. And that builds on the context where you identified you've diagnosed a problem. These are the obstacles, these are the opportunities. So it's a really clear, transparent, step-by-step way of identifying where you're gonna take action. If you're interested in playing with these maps, we have them online. If you look at our website, which I'll give to you at the end of this presentation, we have several examples of both the context and the leverage maps. What you can do right now is navigate the narrative. So each of the loops has a narrative. Let me show you what the map looks like. So if you click on the little numbered titles, those all have a narrative, have text and prose that describes what they are. And they bring in examples. They have links to our other research and other people's research that supports that narrative, as well as examples. And so you can do that. You can look at the interconnections between these loops. It's I think it's a great way to organize this. So please feel free to play with those. For today, as I said, we're going to talk through a few examples. I'm not going to flip back and forth to the interactive map because of technical issues, but know that in the real map, you can actually zoom in to this big spaghetti diagram and start to explore indoor and get a sense of the system. So if we were to zoom in to this loop called the Forgotten Bridge, this will be the example I'm going to talk through today. So the gist of this narrative is that when resources are not matched by current needs in each community, there's a gap that's created that can create health problems. The name of this loop, the Forgotten Bridge, is actually referencing something we found in one of our baseline assessments, which is that one particular poor community, as an example, but we've seen this in many different communities now through our subsequent research, has an open drain, right? So a sewage drain, basically, that gets clogged with garbage because people don't have they don't have regular garbage pickup in that very narrow lane. And it's actually widened the drain to the point that it actually has overrun the little rickety bridge that's been built to cross it to get to other community services. So it's a fairly well-traveled bridge, but it started out not safe, and it's gotten even less safe with the widening of the drain. And actually, we heard that 3 children had died falling in and drowning from this bridge in the months prior to us arriving for that particular assessment. As I mentioned, Indoor is doing a lot of upgrades across the city on a lot of different areas, including waste management. And they were already working to upgrade services around that area, but they had not, the services that they were planning had not caught up to the most pressing needs in that neighborhood. And so this is sort of an example of that Forgotten Bridge where the need is outrunning what is being planned. And the trucks that were built were for more formal, better off neighborhoods with proper streets. And so no vans had actually been built to fit down these narrow lanes to clear the drains. One other example that we documented, it might be more relevant to you guys working within the health sector, is in the urban primary health centers, the government's worked to locate them within close proximity to those that needed them in lower income areas. But the buildings that they were leasing were so run down, understaffed, and poorly stocked that mothers and children, multiple interviews show that they were choosing to pay for private care rather than risk going to, waiting in line for the public facility and not getting the services they needed, even though they were free. So it's this mismatch that we're talking about here. Now, just looking at this one loop, you could build a program, right? But you might be missing these unintended benefits and consequences that are linked to this problem. So if we were to zoom out on the map, which again, you can do in the actual map, and look at those other loops that are connected to the forgotten bridge, you get a better sense of not just what's causing this, but what some of those ripple effects might be. So we call these loops vicious or virtuous, stagnating or stabilizing. You don't have to know all the terminology, but just know that some are positive cycles and some of them are self-reinforcing cycles, and some of them are negative. And stagnating cycles, so if you look at the red loops in the middle, that's what we call our deep structure. It's sort of what everything hangs on. And so we have a positive deep structure of building a healthy city where we're seeing all of that positive growth in indoor and focus on building a really nice place to live that will attract people from other cities. But you have a stagnating loop here called the dark side of development, and the forgotten bridge is linked to this. And it's talking about that the dark side of positive development is that sometimes growth outstrips resources. And so the city is struggling to keep up with that pace of population growth. And in that case, this is when forgotten bridge situations can happen. And I sort of stole my thunder by mentioning that on the previous slide, but this is not mentioned in the forgotten bridge. And it's often not thought about when you're planning a program to deal with services in slum areas or low income areas. You have to change urban planning so that they are planning ahead. So they're thinking well enough ahead that they're seeing that population coming and thinking about how to produce those services. Why speak is another, I don't know if you can see this tiny type on here, but so why speak is just above the forgotten bridge. And the gist of that loop is that if communities try to speak up about their specific needs, if they don't feel like they're being heard or they have no mechanism for actually speaking to those in power who can make changes, this reduces their incentive to participate in future bottom-up efforts. And I'm sure those of you who've worked in countries where there is a bottom-up process where it doesn't work very well, you've seen this. People just give up on the whole process. Just below the forgotten bridge, you have community priorities, loop number 17, and that's actually on the converse side of that. So when communities are listened to, which they are in certain situations for certain sectors in indoor, they might not know what to ask for to align their requests with their end goal of a healthier community, right? So it could be something like asking for short-term needs, like get us bottled water versus get us piped water, or it could be, that they're really not asking they want a school built or a facility built, but what they actually need is workforce. So they don't always have the awareness of what to ask for in that process. I'll just mention one more linkage here, which is to left out, which is just below the dark side of development and to the, right of forgotten bridge. And this brings that whole conversation full circle, which is that if you have citizens that are listened to and they know what to request, even then, if staff are not skilled or motivated to implement the program effectively that results from that, the program is going to still struggle with enrollment and participation, and citizens will again feel deflated about access to crucial services. So this is just one example, one part of this larger map, but I'm trying to give you an example of sort of how this type of mapping can help you remind us as planners and the city as planners to consider all of the layers and levels and people who need to be involved in addressing that forgotten bridge. It's not just about going and fixing the bridge. It's about changing the system to be prepared to plan for and fund and implement these programs, and at best, even prevent that sort of situation from happening, using the full power and participation of citizens and frontline workers. Anyway, so that is just in the first step of this. That's the context, right? So then we go into theories of change, where we're looking at what our friends at Engaging Inquiry call leverage hypotheses, but really I think of them as prerequisites. So you've looked across the system and you're figuring out what are the leverage points, where is the potential for biggest change by making these few adjustments. And then seeing these as things that have to cut through every action that you're going to plan. And for us in indoor, those three prerequisites or hypotheses were data-driven decision-making. So making sure you're not just collecting the data, but it's being used and used by a lot of people. Some changes to policy and leadership, which are described in the loops, in the leverage hypotheses loops, which you can explore online. This one's a little bit more complex, but it's really making sure that your leadership and your policy are not just suited to your citizenry, but are being properly regulated and implemented. And then finally, citizen participation. And that I covered in my description of the loops. You know, there's multiple different aspects of that you need to make sure that you're touching on. So the final step, we bring everyone back together. We make sure that we've got multiple sectors sitting with each other. And then we bring it to the community. We make sure we have multiple different layers of subpopulations and demographics talking to each other to try to come up with what we're calling coherent actions. These are all just terminology to say that, you know, this is a systems level action we're planning. It's going to have to get broken back down to the sector level to get paid for and implemented. So we have to break this back down, but we start up at the top to make sure that we are considering all of those, again, those unintended benefits and consequences and how this fits together. And because we're talking about child health today, I'm using the example from Indoor of the child-friendly city. This is one of the draft coherent actions we've got. And the idea is to create a safe, healthy, and livable environment for children coming from all sections of society. This is very high level, so you got to make this more specific. And I've only pulled out a few tidbits here that fit on the slide, but we give a full background that pulls in all of the different levels of evidence that we have. And then the final proposal is quite in depth, but it tackles activities across awareness, both for the community and for health workers and other workers, workforce pipeline and skills building for the existing workforce, infrastructure improvements for buildings and for green space, supply chains and service delivery, especially around safe delivery, nutrition, immunization, and education services. You have to have a lot of different parties involved. And so this was co-created by those in the Smart City Office, the Education Office, Women and Child Development, Health, and there's a few other departments that are involved more peripherally. But that proposal, this is where we show how it fits together and that we've considered how these aspects interact. But after this step, we actually create a very detailed sector by sector grid that tells each sector what it's responsible for and makes it easy for them to just take that out and plug it into their yearly work plans. Because previous research I've done and others have done on system strengthening shows that no matter how much multi-sectoralism you're doing, at the end of the day, you got to get into the single sector work plans for it to get funded and done. So we're trying to balance those two sides of it. In our final planning, we will have estimated costs for that grid, and then we're doing simulation models to actually give them a sense of, if you were to implement this at 90% or 100% across the city, you would get this much reduction in child mortality or this much reduction in maternal mortality or whatever. We're still talking with the city about which indicators they're most interested in, but that's going to be part of what we're doing for the final action plan, which is the final step of this project. So we've done our baseline assessments, we're doing the systems mapping, we're doing multiple other research reports. We're gathering a huge amount of citizen feedback ourselves, but also improving the feedback systems directly to the city. And they're going to be feeding that into this action plan. And then of course we have our multi-sectoral platforms that the city has created, all feeding information into what we are calling the city action plan for a healthier indoor, a healthier Makassar, or healthier Da Nang. We as a project put out that proposed plan, which has the aspects I just outlined in the action slide. But then we have almost a year where we workshop this. We're about to release these at the end of December. They're going out to the cities. And then we'll have 9 months to workshop those action plans with our policymakers, the sector planners, the citizens, all of those who have been involved with us from the very beginning, to get their feedback. What are we still missing? What wouldn't really work here? Trying to make sure that we're covering all of the obstacles and opportunities we talked about in the context map, and making sure we have all of our leverage prerequisites in each one of these actions before we finalize those action plans. And of course, we need to run the simulation models to get those estimated impacts. But then that final city action plan, the hope is that it's not us, BHC, putting out that final city action plan. It's actually the city putting out the action plan and signing it. And actually in Makassar, in our Indonesian city, they are holding us to our deadline on the city action plan because they've already had all of the sectors involved in their multi-sectoral platform sign a charter. After the action planning workshop, they were so engaged and excited that they said everyone has to sign this charter, that they will support these activities, and this will be part of our smart city plan going forward. So it is working in at least one city, and Indoor is really keen. They want to see what we're coming up with. They just got a new CEO last year, so we're still sort of reorienting her to the whole process, but it is moving toward that. So I'm hopeful that we will get to there, at least in our first 2 cities. So I know we're probably out of time now. Yes, I'm over time. So just to say, you can engage with us and learn more about these aspects in a lot of different ways. Check out our webpage, our journal articles. We've got videos on YouTube and a webinar series in each country with local university partners. We also have a Facebook Live series that's in partnership with JSI's Urban Health Group. And you can follow us and share our progress on social media. I will say we have a weekly resource bin that some people have really found helpful, and it has special topics each week. So if you'd like to join that, please write to me and I can connect you with our project officer who can include you on that list. And with that, I'll say thank you for your attention, and you can find us at these addresses.
Excellent. Thank you, Amanda. That's really enlightening. And I couldn't help think, how many times have we been to a city in one of the developing countries and you thought to yourself, what on earth happened here? Because the planners were not thinking ahead. So this is an excellent example of working with cities that are thinking about the future as they plan and implement their projects today. And again, many times we've come across either planners or maybe policymakers who are genuinely struggling to make a difference, but it is just more difficult or harder because of decisions that had been made long before their time. So I hope that this is a great example of, as someone commented, Lee Pine, that this is a great example of systems thinking principles applied to improve health and development moving beyond a project. And I would also add that we can use this lens to become better advocates for children, but in a systems approach. So I hope you all found this interesting and would have the opportunity to to follow up and learn a little bit more. We have time for discussion and just agreeing with all the comments. This is a fabulous presentation and really exciting. So by way of questions, let me see what we already have in the chat function. Okay, so from Amadat, I may not pronounce the name correctly. Thank you, Amanda, for sharing great insights from the well-implemented project. I want to know if there was any socio-political challenges while implementing this project, and if yes, how it was dealt with. So that's just one question to get us started, Amanda.
Sure, yeah, it's a great question, and it's always something we have to work with. So we have been keeping track of what we call external shocks throughout the project, both because that also informs, how we do as a project, but also because it's important to understand if we're thinking about this as a learning project, and how do you stay flexible and resilient in dynamic urban settings? You have to keep track of what those changes and those shocks are. So I would say the single biggest thing that we've faced across all of the cities. So we just joined Kathmandu. Kathmandu has just started up 2 months ago. So we haven't started engaging to the point where those shocks would affect us there. But in our first 3 cities, the most common shock to the project is changing government staff. And this is certainly true in the sectors, our points of contact will change over time, but there's usually a decent handoff there. But changes at the political appointee level, so mayors, district collectors, changes to state leadership that affect municipal staffing has certainly affected us along the way. And in fact, in Makassar, Indonesian city, we started with the mayor who had spearheaded the Smart Cities effort for Makassar. He was a very well-liked mayor, really savvy at how to both engage citizens and to think about working across sectors. Of course, for his own political reasons, he wanted to improve the city, let's not dive into why he did this, but he was very influential and made a lot of progress and was popular. And there was quite a scandal that was sort of created around him because he had given out smartphones to implement a new community level data gathering effort. So it was sort of like the level of the community health worker. He was handing out these smartphones, and someone said he was bribing them. So then he was kicked out of office, and there was one interim mayor after another. We're still waiting for the official new election. But I think because we have stayed engaged with that office and with ComInfo, which is where the Smart City work is actually being implemented, we've been able to get back in to meet with each of the new mayors. And we have our signatures, our MOUs, we've got now this charter with BAPADA, which is the planning office. And the stable, so the first mayor, or might have been the second mayor, convened the multi-sectoral platform for us. And so that has continued. So it shows that sort of we're building these systems along the way. It's not just that we're this separate project that was the pet project of the first mayor. We've sort of been able to make friends along the way. And the more we hand off our approach to other city offices, the less it depends on that mayoral favor. And not in a similar, but maybe not as dramatic way, the CEO of the Smart City Special Purpose Vehicle in Indore has changed over many times since we've been there. And particularly with COVID, with this last CEO, we weren't able to meet with her in person the minute she came into office, and then she went on maternity leave, so we had a break in our relationship. And so Damodar and our fantastic city officer Neeraj Mishra in Indore have been really bringing her back up to speed, and and keeping her engaged. And now she's starting to really get excited about this project. So I think that would be the biggest single. I mean, obviously COVID is a huge external shock, but for the purposes of time, I won't go into that on this call. So yeah, I think that's probably the biggest external political shock that we've faced.
Thank you, Amanda. Moving on, we actually have a number of interesting questions. One around the politics from Stefan Swatling. Is this the process engaging primarily technicians and planners, or also political leaders? And the second component to it, what's the political potential gain in this? Somewhat touched on in your previous answer, but
yeah,
if you can respond.
So let me just make sure. So he asked which planners, and then if the political process is engaged. Is that right?
Are you in this process engaging primarily technicians and planners, or also political leaders?
Gotcha.
And
okay.
The second bit is, what is the political potential gain in this?
Okay, so I've mentioned some of that, but I'm going to ask Damodar if he wants to weigh in, because he's had quite a bit of direct contact with the technical staff in the sectors to talk about this project. And then also he, having previously been a high-level ministry official, he also has been able to play some of the political aspects of the project to make sure that, because politics are important. We've done a political economy analysis in 2 of our cities to make sure that we're considering that aspect. But anyway, I'll let Damodar weigh in on this.
Thank you, Amanda. Well, yes, initially our main interaction was with the technical as well as city planners, because it's a city-based project. Maybe in Makassar, mayor, who is also a political leader, was also quite engaged. But we feel that as BHC approach is being expanded, for example, in the province of Madhya Pradesh, there's already a dialogue going on why we have concentrated only on one city. So the state political leadership wants this project to be expanded to other smart cities of the state. And similarly, before COVID, we had communication with my colleagues from USAID also coming, and we met the Ministry of Urban Affairs and Housing, and they wanted a national level workshop, maybe at the end of this particular project, to disseminate this type of approach to other 99 cities of the country. So definitely, as a byproduct, there would be more engagement of political nature at a higher level. Thank you.
Thank you for that. And moving on, another question: the point of linking program outcomes to sector level budgets is critical. How does this then allow transformation at the level of particular ministries? How does engaging with integration of policies, how engage with integration of policies, particularly where intra-ministry planning is not data-driven?
Yeah, so I'm going to mention some of the limitations of our particular project here, because we are working, as Damodar said, at the municipal level. We are trying to make changes to policies at the municipal level. As he alluded to, you do need to, there are certain, and you'll see in our political economy analyses that are now on our website, one of the difficulties that any municipality has is that each sector is actually managed at a different level. So particularly with education and health, they're very top down. In almost every country we're working in, those are the most top down sectors that we deal with. And so they don't even sometimes have a municipal level of authority. It's district is the lowest it goes. And so, the cities within a district, that is the body that you're liaising with. And you really need to, particularly in India, get the approval and buy-in at the state level to make any major changes of policy within education and health. In Vietnam, we are really struggling because they have developed one multi-sectoral platform already before we got there around food safety, the Food Safety Management Authority, which does engage health and agriculture and a few other areas, but it doesn't include education. And a lot of what we've come up with them through the systems planning process have been educational activities and improvements that require access to school-age children, which is best done through schools and improving, or adding to the school curriculum around food safety. And all of that in Vietnam is central level, and you are not going to change it for one city. So that is a limitation of what we're doing. Is it ministry level changes, which are required for several sectors to make meaningful changes at the city level? Those have to be negotiated higher up. And I think, so I should say USAID is using this project to think about funding another urban health project that would be larger and more implementation focused. And I some of the recommendations that we're giving them is that they need to build in that staffing and the time and the effort to support central and state level change. You can be defining the change at the municipality level, but you're going to have people up at those upper levels for certain sectors.
Mm-hmm. Great. Thank you. Another question around children with disabilities. How are the SDG indicators factored in the inclusion of children with disabilities and their families integrated where multi-sectoral cooperation is essential and explicit in SDG 4.2?
I did mention the SDGs that this project is related to at the beginning, but where it's been most specifically included in our planning processes has been in Makassar. So they use a musrembang process, which is a bottom-up process for planning. And within that musrembang process, the city has to consider both the community priorities that are brought up against sector targets and the SDGs, all of the SDG goals. So we have actually helped Bapeda improve their musrembang prioritization process to combine these three criteria: community priorities, SDGs, and sector targets, to be able to more easily process the huge amount of information that's coming up from the bottom level. And I don't know, Damodar, if you want to talk any more about how the SDGs are specifically being considered in that process. I'm struggling to remember exactly how they've used those, but I know that is a key criteria for how they're deciding on projects.
Yeah, actually, as you mentioned right in the beginning, we are focusing on 4 of these SDGs. Including health being the main outcome SDG. So I have nothing more to add on this.
Yeah. So we don't touch upon the 4.2 at the project level, at the central project level, but within Makassar, they are considering it down to that level, and those are used. I need to go back to our training material on the prioritization process and how they've done that. But disability and those who are disabled did come up quite a bit in Makassar. So even outside of that process, within the systems mapping, we try to define the most vulnerable groups or most vulnerable populations. So it's not just a throwaway line. If we talk about most vulnerable populations, for each city, those city stakeholders can define who those groups are. And disabled did come up as a vulnerable group for Makassar, in part because in terms of transport and pedestrian access and access to facilities, this is a city that has multiple islands in it, and it has multiple areas that get flooded. And so those who are physically disabled have a harder time getting on the boats or hopping over. It just makes it a bit more physically difficult to get to some of these areas. And so the disabled are listed, and they are now We've helped with our work with the health centers in Makassar to encourage the city, and they've now developed separate check-in lines at the main hospital for those who are disabled and the elderly.
Thank you, Amanda. We are almost out of time, but maybe we can slot in 2 quick questions. One is, could you share some insight on how the 4 cities were selected? And then a second question is, did you conduct pre-assessment to find out the baseline data in order to inform project success, and also reprogramming or removing components and adding new ones? I know there's several aspects to that question. Just briefly talking about, did you do pre-assessment and have baseline data, and having that idea of evaluating the program, removing components, adding new ones, and looking at sustainability?
Yeah, so this is, I love to think about evaluation design. Dynamic urban settings, RCTs just do not fit systems approaches. So for our separate individual pilots, we did baseline assessments, qualitative assessments to understand some of the baseline conditions in each city, for sure. We've also done pre and post type evaluations of some of the pilots that we're doing, particularly the health promoting schools. We did an NCD city level representative survey in indoor with cost share and collaboration with Smart City. And we will be doing a post assessment of built environment components in slums. That was one module in there. So for multiple individual pilot interventions, this isn't an intervention project, right? This is an applied research project. But for some of the pilots, we have done pre and post data collection, and we'll be doing evaluation of impact for those. But because this is a dynamic systems type of project, and so as I say, the traditional pre-post, even if this was an intervention project, pre-post is not going to fit the bill. So what we are trying to document are what are some ways that this type of project could be evaluated in the future. We are running the simulation model where you can move different pieces to test what would this look like if you left out this or this or this. And that should give us a lot more information about how to design evaluations for these types of projects going forward. So it's a great question. This is something that we do. This is what we're trying to feed back to USAID, not just what might work, but how could you evaluate it in the future?
Thank you. And quickly, selection of cities.
Selection of cities. So we wanted to do smart cities. We wanted secondary cities. You mentioned, Ines, you see these cities that have grown and you're like, gosh, how did this happen? And it's not just in low and middle income countries. I mean, the first smart cities in the US were disasters. And some of the ones in China, you see these ghost cities, right? They're built for like giants with no sidewalks for crossing 4-lane highways. So we wanted to get in there and really have them think about the human and the citizen in the design of the future city. So that was the main selection criteria. USAID told us which countries to consider. We had started with India because they have this really strong smart cities program across the country, and we knew that they had some need for a health partner to sort of help them with this. But then Indonesia and Vietnam were added based on suggestions from USAID. And then Kathmandu actually asked us to join. And we have a very specific engagement there around rolling out their air quality action plan. So we won't be doing the same full process there, but we'll be using a modified systems mapping approach for rolling out that plan.
Well, thank you. Our time is up, and I know we haven't responded to all the questions and some comments, but I think overall this was enlightening. And we do have the website information where we can go and look at some of the results or the information that was referred to. And you can always email us or email Amanda directly if you have questions, but I hope that you did find this helpful and you have some ideas that you could include in your work. So thank you, Amanda. Thank you, Demeter. Thank you, Sita, also for organizing the logistics, and thank you all for participating.
Thanks, everyone.
Thank you. Thank you very much.